Assalamualaikum doctors. In this video I am discussing a history that is about long QT syndrome. It comes from Singapore 2024. So long QT syndrome is the chief complaint is that child came with after fainting attack, like suddenly the child is fainting attack. So how can we take the history? First analyzing the chief complaints, present illness. What is the main concern? Is there any fever, awareness of the heartbeat, fainting, chest pain, inability to walk? Is it first time occur or happened before? So, what is the main concern? Main concern can be any fever, any awareness of heartbeat, fainting, chest pain, and inability to walk. So, we ask that first time occur or happened before. Then, what happened before, what happened during, and after? Is there any associated symptoms like rigors and fits? The CVS history of any previous fainting episodes, exercise intolerance, blue or pale lips, awareness of the heartbeat, blood pressure measured. So here CVS we are taking early. History of any previous fainting attacks, exercise intolerance, blue or pale lips, awareness of the heartbeat and blood pressure measured. Then general about the activity, appetite and sleep. Other concerns about dysmorphic features. Long-term medical condition or chronic illness. Known to have any cardiac disease since when, how he was diagnosed, who diagnosed him, any admission with its details if any, which team he is following with, any medication he is taking, any similar attack before requiring admission and antibiotics, COVID contact, COVID vaccine to close contacts. So any long-term medical condition we need to know. Maybe the child have any known case of cardiac disease, then we will be know that. Then the systemic review, we are going from the chest, any recent cough and cold, difficulty in breathing, noisy breathing, snoring during sleep, asthmatic, recurrent chest bugs. About the CNS, headache, weakness, facial asymmetry, eye deviations, any concern about vision, hearing or speech, unusual walking pattern and change in mood. Urinary, about the change in the urine amount, color, frequency, pain in the loin and pain during peeing. MSK skin or any skin spots, any painful or painless lesions in the hand or top of the fingers. So sign of infective endocarditis also we are searching, any painful or painless lesions in the hand or top of the fingers. Muscle weakness, difficulty in climbing stairs or in getting up. Swellings in the hand and feet, bone, joint pain or joint swelling. GIT about the tummy distension, tummy pain, throwing up especially in the morning and change in the stool. Hematology, pallor, bruises, bleeding and bugs. Endocrine, cold intolerance, blood glucose test. Perinatal, any event in pregnancy, jelly scan result, newborn screening, NIQ admission. Puberty started, menstruation, is it regular, boyfriend, OCP and protection. Vaccination, vaccinated up to date, any recent vaccinations. Allergy to food or medications. Nutrition on a special diet, type of food, amount and growth chart. And the development if below then 2 years. Then about the family. Describe your family for me. Consanguinity. Similar condition in the family, family history of cardiac disease, any history of sudden death in the family. So these are the some lines we need to add in fainting attack. Like similar condition in the family, family history of any cardiac disease, any history of sudden death in the family. Then we are going to the social, school, psychological impact. So how this condition affect the school achievement, about socially and psychological impact. And when someone comes with syncopal attack, like loss of fainting attack, what are the DD comes in our mind. First is cardiac causes are tachyarrhythmia. First, number one, ventricular tachycardia seen within long QT syndrome. So ventricular tachycardia, long QT syndrome, supraventricular tachycardia, atrial flutter, atrial fibrillations, arrhythmogenic right ventricular dysplasia, ARVD, then bradyarrhythmia, that is complete heart block, asystole and pacemaker malfunctions. Obstructive lesions are aortic stenosis, pulmonary stenosis, hypertrophic cardiomyopathy, pulmonary hypertension, mitral stenosis, constrictive pericarditis and tamponade. Myocardial dysfunction or coronary artery anomalies, cardiomyopathies, ARVD. Orthostatic hypotension are age group 10 to 16 year, uncommon age less than 6 year. Drop in systolic blood pressure more than 20 mm mercury and or diastolic blood pressure more than 10 mm of mercury within 3 minutes of upright positions. So orthostatic hypotension we understand, that is age group 10 to 16 year. What is the definition? Drop of the systolic blood pressure more than 20 mg of mercury and the diastolic blood pressure more than 10 mg of mercury within 3 minutes of upright positions without any moving. What is about postural orthostatic tachycardia or syndrome, POTS? Postural orthostatic tachycardia syndrome or POTS is that age group, usually teenage girls, increase in heart rate more than 30 beats per minute or heart rate more than 120 beats per minute within 10 minutes of standing position. So we understand what is postural orthostatic tachycardia syndrome, that is heart rate in teenager girl more than 30 beats per minute within 10 minutes in standing position. Okay. Now about the red flags of the cardiac syncope. These are number one, exertional dyspnea, exertional syncope is associated with swimming, loud noises, chest pain, palpitations, and supine positions. Okay, these are the red flags. Known congenital or acquired heart disease, family history of sudden death, age less than 40 years, inherited cardiac condition and conduction disorders. Early ischemic heart disease, age less than 30 years. Other characteristics, absence of prodromal symptoms, injury can be common. What is situational syncope? Circumstances and activity before syncope like micturition, cough, and vomiting. And neurological causes are reflex anoxic seizure, breath holding spell, seizures, migraine, brain or spinal tumor. Okay. So these are the DD presents in our case. And also the clinical feature we understand. Prodromal symptoms is absent usually. Injury from syncope is common. Other symptoms are abnormal movement, posture, abnormal eye movement, urinary incontinence, postictal confusion, sleepiness, focal neurology, and preceding headache. Then psychiatric causes sometimes. Psychiatric is the panic attacks, medically unexplained or psychogenic syncope. Clinical features are prodromal symptoms, variable hyperventilation or tingling sensation of the extremities, multiple daily episodes, and stress factors. Metabolic causes are hypoglycemia, electrolyte disturbances, and eating disorders. Drugs and toxins are clinical features with relevant past medical history present. Example, diabetes, eating disorder. Okay, so these are the DD comes in our mind, and among them long QT syndrome they choose in exam hall and they take the Viva long QT syndrome. Thank you.